Welcome to today's EM in 5. We're going to talk about something pretty simple. Basically, it's a neurology hand exam. And I'm going to show you basically a quick trick to do it in a couple of seconds. It's a good thing to have in your back pocket. So this is the whole exam. And you're going to cover the medial, the ulnar, and the radial nerves. That's C5 through T1 in total. And this is the whole exam. That's it right there. So let's just go through this quickly. So first off, let's go through the sensory nerve distribution of each of these. So here's the median nerve, just as a review. So it's going to be the palmar side in the first, second, and third digit. This is the sensory distribution of the ulnar nerve. So it's all of the fifth digit and then about half of the fourth. And that's both the dorsal and the palmar side of the hand. And then lastly, we have the sensory of the radial, and this is going to be on the dorsal side of the hand, covers most of the back of the hand, except for the fifth digit, which is the ulnar, which we just discussed. Now the motor nerve exam, so let's start off with the median nerve. You have them make a ring with their first and second finger, and you're going to try to break the ring. So you tell them to hold there, and you try to break the ring apart. That'll test the median nerve. Next we have the ulnar nerve, and this one you're going to have them spread their fingers apart, and you're going to abduct against resistance. So you're going to try to close it, and you're going to tell them to hold it, and have them try to close their hands against you. And last we have the radial, and this is going to be dorsiflexion against resistance. And one other way to remember that one is you think of radial nerve palsy as wrist drop. So here you can see an exam of patients trying to dorsiflex their hand and they're not able to, and that's a radial nerve palsy. Now here's one last little trick. You can actually make all of these three movements into one motion that tests all three of the nerves. So if you have them do the kind of OK sign, then spread the third, fourth, and fifth apart, and then have them dorsiflex up, that actually tests all of them. So right here we have the median, right? That's kind of the OK sign. You have them spread their fingers apart, that's the ulnar, and then if they dorsiflex up, that's the radial. So if you have them just do that one motion, that actually tests all three, even better. So here's just the three to remember. The OK sign, break the ring, that's the medial nerve. Spread the fingers apart, that's the ulnar nerve. And then basically what I call kind of the stop sign or dorsiflexing the hand, that's the radial. Or you can do them all at once with this motion. So that's the rapid neuro hand exam, and here's some references. Thanks for joining us on EM in 5.